Hello, my name is Lacy and I will be presenting on compassion fatigue in veterinary medicine. I'm going to start off with a scenario based on my experience working at a walk-in veterinary clinic. When a vet shows up to the clinic in the morning, they are immediately going to be presented with phone calls, questions, test results, prescriptions that need to be filled, client calls that need to be made, and maybe paperwork and other things of that nature too that all need to be done before they even start seeing their patients. Plus, when they get there, there's probably already a waiting room full of patients ready to be seen. Euthanasia is arguably the most difficult part of a veterinarian's job, especially when it's a patient that they've known for the entire lifespan of that animal, and they know the family and the owners, and it's going to be difficult when they have to go into a room where the owners are emotional and struggling, and they have to help in that situation and perform the euthanasia, and then they have to leave that room and immediately compose themselves so that they can enter another room and see other clients. To compose yourself, because maybe you have another patient right next door who's ready to be seen. Maybe it's even a puppy who's young and their family is really excited for you to meet them, and you have to go in there with the ability to match their emotions and provide quality care no matter what. The average day of a veterinarian is also going to include seeing cruelty cases, sick patients, healthy patients, patients whose owners can't afford the care that they need, and maybe owners who are making ignorant or selfish decisions for the care of their animal. And on top of all of that, when it gets busy, a lot of times vets might not even get a lunch break and are working 8+ hours nonstop with no break. Clearly, the veterinary field is exhausting and a lot of work, but veterinarians still do it because they are passionate about providing quality care for animals. Next up, we'll do some general definitions. Compassion fatigue is going to be a state where people who are caring for others, whether that be people or animals, get emotionally exhausted and start to withdraw from their emotions and their connections, and they get into a state of trauma themselves based on what they're seeing in others. So ultimately, let's look at the design of the veterinary field and how we get to the situation that we are in. Some typical characteristics of the veterinary field are going to include that veterinarians are regularly encountering trauma, death, cruelty, mourning, grief, financial difficulty, things of that nature. They're also regularly going through ethical dilemmas, and that causes moral stress and moral injury. And like I mentioned before, they have heavy schedules, long hours, lots of work. And stereotypically, veterinarians are going to have a tendency to fear making wrong decisions and also have a weakness in which they let people exploit them and their knowledge and their skills. So other than compassion fatigue, there are some other associated impacts to the flawed design that is the veterinary field. Some other major issues in the veterinary field are work-life balance struggles, veterinarians leaving the field before they reach an age of retirement, and then therefore major veterinarian shortages, and most significantly, high suicide rates due to compassion fatigue causing depression in veterinarians. So, some changes and solutions. Being able to recognize the signs of compassion fatigue in yourself and in others is going to be really important to prevention. So noticing signs of isolation, apathy, bottled up emotions, or sleep problems are going to be major indicators. Additionally, doing regular screening to monitor mental health can really help in the prevention or early treatment of compassion fatigue. And lastly, just making sure that you intervene with your feelings and maybe go to therapy or counseling, find social support, and just implement really good self-care habits is going to be super beneficial. In the field itself, some ways that change can be implemented would be making sure that vets are getting breaks and having more structured hours so that they are not overworked. Additionally, minimizing stress when it comes to euthanasia and death by giving them time to process their emotions and giving them a space to unwind and just feel those emotions is going to be really helpful, as well as having clear plans on how to approach those kinds of situations. Stress intervention and social support, again, are going to be really important changes that occur. So here are some resources that I used in preparing this presentation. Thank you all for listening, and I hope you learned some interesting facts.